Hi, I'm Megan, and today we're going to talk about fluid and electrolyte imbalances and how they may affect you and your body. Some labs that you may have done to determine if you have fluid volume deficit include hematocrit, your BUN or blood urine nitrogen, urine specific gravity test, along with serum sodium levels and serum osmolarity levels. Some of y'all may be asking, well, what are electrolytes and were they for? Electrolytes are charged ions that are dissolved in the body that help maintain balance of fluids in the intracellular fluids, and extracellular fluids. Um, some of the most common electrolytes in the body are sodium, potassium, chloride, magnesium, phosphorus, and even calcium. There are several different range values for each, and I'm going to go over those here in just a second. And each one can help tell if you are low in one area of a electrolyte versus higher in another. So for sodium, the general expected reference range is 135 to 145 milliequivalents per liter. Potassium is 3.5 to 5 milliequivalents. This is a very small, narrow range for this particular electrolyte. Magnesium has a similar small range, such as it is 1.5 to 2.5 milliequivalents. Calcium, the range is a little bit larger. It is 8.5 to 10.5 milligrams per deciliter. So you have a little bit more of a leeway with the calcium level. Chloride is 95 to 105 milliequivalents per liter, while phosphorus is 2.5 to 4.5 milliequivalents. Now, you may be at home asking yourselves, what does this mean to me? Like, what do I need to know about this? Reasons that you need to know about this is because if your electrolytes are off, they can affect you tremendously, anywhere between just some nausea and vomiting all the way to seizures and coma. So I'm going to go over just a few concerns for electrolytes. There's three that I'm going to go over. These are sodium, magnesium, and your potassium levels. These are like the three most common and most critical in the body. Excuse me. The first one is hyponatremia, which is a sodium level of less than 135. Some labs you'll see 134, 133, but usually it's generally a lot lower than the 133. Some signs and symptoms that you may have include muscle weakness, headache, confusion, fatigue, decreased deep tendon reflexes, seizures, lightheadedness, dizziness, and generally just an overall nausea feeling. If you experience any of these, you may want to go get your blood levels checked. And since I am in nursing school, some of the things I'm also going to go over is the nursing care or nursing interventions one could do to help increase these levels for their patient. So for hyponatremia, you could replace the sodium levels via an IV using just normal saline or lactated Ringer's solution. If the patient is able to drink fluids, you can also encourage oral fluids and give them foods that are high in sodium, such as beef broth or even tomato soup. Now, as a nurse, you'll also want to monitor their input and output. Make sure that what they put in is coming out. So you're going to have to measure their urine levels. Also, their weight, because if you are replacing sodium, too much sodium can cause edema and swelling and so forth. So you're also going to want to monitor their vital signs and their level of consciousness in order to help treat this. Excuse me. One thing, however, hyponatremia could lead into hypernatremia, which is your sodium levels that are higher than 145. So you want to keep your level within that window if possible. Now, some signs and symptoms of hypernatremia include excessive thirst, a dry tongue and mucous membranes, tachycardia, restlessness, irritation, seizures, nausea, vomiting, and even coma. So if this level gets too high, it can be a really big issue. Some things you could do as the nurse is you're going to want to monitor level of consciousness, the vitals, their heart rhythm and heart rate. You're going to want to listen to their lung sounds or auscultate them to make sure that there's no fluid buildup around the lungs that could lead into, say, pneumonia. You also want to provide oral care because, again, if they have a dry tongue or a dry mouth, then that's just a breeding ground for bacteria. You can also encourage them to drink less or restrict their fluids. But you also want to monitor their input and output. Again, same reason as the natremia, is you have to monitor their urinary status to make sure, their kidney function is still good. You can also, if they have an IV line, you can also give them 5% dextrose and water. For some reason, the dextrose in the water or the sugar helps combat the salt levels. Excuse me. Moving on to potassium, which again, that range is 3.5 to 5, so very narrow window. Some things you could see with this would be a decreased blood pressure, weak pulses, altered mental status, such as confusion, anxiety, nausea and vomiting. Nausea and vomiting is pretty common with just about any disturbance in the body. But you could also see just a generalized muscle weakness and shallow breathing. Now, most of the time, what nurses are able to do with this, the big thing for them is they have to monitor the patient's ECG, or I'm going to say EKG, because that's what some people call it, or their electrocardiogram, mainly for their cardiac status to make sure that that the QRS waves are getting back to normal, that they're not overly, stretched out. Excuse me. Some other things that you'll also see them do is they're going to monitor and maintain, adequate urine output, observe for shallow breathing or diminished breath sounds, cardiac rhythms. You want to also monitor their level of consciousness and their oxygen saturation, because if you don't have oxygen, then there's a problem. Potassium also plays a part in muscle. So like I said, the general muscle weakness. So you're going to want to ask them to, grasp your hands to test that muscle weakness and also possibly their deep tendon reflexes. To help combat hypokalemia would be to encourage foods that are high in potassium, such as the obvious bananas, oranges, milk even, and surprisingly avocados and cantaloupes are a pretty good source of potassium. If your patient is not willing to eat any of these foods, you could encourage or provide supplements, such as just like an oral tablet or possibly an IV of potassium. With that being said, you never want to give potassium via like an IV push or a bolus because you could potentially kill them. On the flip side, hyperkalemia, your levels are going to be a lot higher than 5.0. Again, this can cause tremendous muscle and cardiac concerns, such as a slower irregular heartbeat. You could have decreased blood pressure or hypotension. You could be irritable. Diarrhea could be involved. And you'd also have hyperactive bowel sounds. One of the ways I've seen this used, one of the ways I've seen this be combated is through the use of Electrolyte or a medication called Lokelma. I can't remember the pronunciation, I'm sorry. but these help to decrease those potassium levels. As the nurse, your main concern is going to be patient safety. So you're going to want to prevent any falls, assess their cardiac complications if there are any, and intervene appropriately. But you also want to avoid those high potassium foods, like I mentioned a moment ago, and possibly administer Lasix or furosemide, which will help promote the excretion of excess potassium. And again, you want to monitor their ECG and for cardiac changes, because potassium has a big effect on the heart. Excuse me. Moving on to magnesium, we have hypermagnesium, which is a magnesium level greater than 2.5. Now, some of the nursing considerations or nursing care that you'll generally see is, again, they're going to monitor your vital signs, level of consciousness, deep tendon reflexes, make sure that they are appropriate. You're also going to want to monitor their respiratory status and cardiac rhythms, because just like potassium, magnesium affects the heart just as well. For a severe cardiac issue that is related to the hypermagnesemia, you can give calcium. Calcium has been known to kind of reverse those effects of the magnesium, which I didn't know that until pretty recently. Now, with hypomagnesemia, which again, your magnesium levels are 1.5 to 2.5, so this is going to be anything less than the 1.5. You may see a depressed mood, agitation, overly active deep tendon reflexes. So you're gonna hit that reflex and their arm's just going like boop. You're gonna possibly see signs of constipation, a paralytic ileus, hypertension, which is really high blood pressure, tetany, and even seizures. Seizures is a big thing with some of these electrolytes if they get out of whack. I haven't known anybody to have any of these concerns, but some of the nursing care, nursing considerations, if you will, is you want to discontinue any magnesium depleting medications such as diuretics. You can give oral or IV magnesium depending on your patient's level of consciousness. Level of consciousness and what they're comfortable with, because again, it's for the patient, it's for the benefit of them. You can also encourage foods that are high in magnesium, which are going to include your dark green leafy veggies, nuts, seafood, and even peanut butter. That was a little interesting to me. I didn't realize peanut butter was a good source of magnesium. So something that we came up with for this video is like a question of the day series. So one that we found that pertained to the electrolytes subject is a nasogastric tube is attached to a low suctioning intermittent device. Which electrolyte imbalance should the nurse monitor and assess for? Anybody know? Anybody? So I'll give you a hint. If you have nausea and vomiting, typically you're losing not only fluid, but you're also losing sodium. Hint. So the answer is going to be hyponatremia. Again, due to the nasogastric losses that are isotonic and contain sodium. So, nausea, vomiting, even though it's pretty common with all the electrolytes and all the electrolyte balances, it is most common with sodium levels. I hope you guys enjoyed this video. Hope you learned a little bit of something today. And again, if you have any questions or comments, leave them in the message below. Thanks. Bye.